What's up, guys? It's Dr. Ryan Garner with Apothecary Wellness. Atrial fibrillation, also known as Afib, is the most common arrhythmia amongst adults. It has a 1 in 6 lifetime risk and a 1 in 4 risk for those over the age of 40. Now, we normally just think about Afib in older demographics, but a study by the American Heart Association that was released last year looked at 67,000 individuals with Afib and actually found that a quarter of them were under the age of 65. Now, common risk factors we saw amongst these individuals were obesity, smoking, high blood pressure, diabetes, high cholesterol, and a history of heart failure. And these individuals were at a much higher risk for poor health outcomes. In fact, they were at a much higher risk of being hospitalized for complications with AFib, heart failure, or myocardial infarction, which we generally refer to as a heart attack. Not to mention, during the follow-up period of greater than 5 years, greater than 7% of those under the age of 50 died, and about 13% of those between the ages of 50 and 65 died. So this clearly demonstrates the need to keep an eye on these individuals, not only to improve their health outcomes, but to mitigate excessive costs for health plans. Now, luckily, most antiarrhythmic medications for AFib are relatively inexpensive, at least those that are used on an outpatient basis. But one of the more serious complications with AFib is the risk of what's called a cardioembolic stroke, where due to their AFib, their blood can coagulate, and we worry that that clot could make its way into the brain. Now, we typically only use anticoagulant medications in older individuals, and we have a scoring system called the CHADS-2-VASc scoring system that generally identifies an individual that has a greater than 2% risk of having a cardioembolic stroke. But as we mentioned, the individuals who were under the age of 65 had risk factors that are part of the CHADS-2-VASc scoring system. Things like history of a heart attack, history of heart failure, diabetes, hypertension or high blood pressure. So it does seem fairly likely that an individual with AFib under the age of 65 who would likely be on an employer health plan could also have the risk factors that would require anticoagulation. And we know that newer agents, referred to as direct oral anticoagulants, actually have better outcomes than warfarin. And unfortunately, these medications do come with a much higher cost. They can have list prices around $600 per month, as some of them have list prices near $600 per month, and others are generic. Proper management is necessary to determine which anticoagulant they should be on, if at all.